Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Dr. Grove, how you doing today?
Dr. Darrow, living it up. I woke up today, Doc. It's a good day.
You're on this side of the green?
That's right.
Speaking of which, I'm going to go out to the greens later today. It's so gorgeous out, and I'm going to go play some golf and do my typical run in the park with Bella over the ocean. Bella's my 12-year-old husky. Going to pump up a little bit. How many pumps have you done today so far?
Just one, Doc. Got one to go.
Got to stay in shape.
I got a bone to pick with Bella, by the way. Yeah, she was acting real comfortable with me this week, Doc. And you see what happened? She was trying to get after the steak.
I know.
You saw that.
She knows where the food is. I thought she liked you. Anyway, our show today is all about musculoskeletal orthopedic pain, and that can be anything from the head, neck, the arms, the shoulders, the back, all the way down to hips, knees, toes, fingers, arthritis, rotator cuff tears in the shoulders, meniscal tears in the knees, labral tears in the shoulder and the hips. We got the whole thing covered. Dr. Grove is probably the number one, in my humble opinion, the number one injector and ultrasound reader on the planet. And I'm so grateful to have him working with me. And he's just a great guy. I love you very much, Dr. Grove, and it's a pleasure to have you by my side here doing all the injections these days. I want to give out the phone number so people that are interested in how PRP, which is platelet-rich plasma, and stem cells can actually heal their bodies without having a needless invasive surgery. I've been on this track for 27 or more years, and I knew when my wrist was healed overnight, 50% overnight, by a simple injection of prolotherapy, which is the old school form of regenerative medicine with PRP and stem cells. I knew I was on the right track. Then I injected my shoulder that healed overnight after a failed surgery. And for you folks that want to call us, we would love to have your calls. It makes us excited. You can try to stump us with questions about musculoskeletal pain. If you're shy, pretend you're your father, your sister, it's about your cousin, whatever. And you can give out a fake name. We don't care. So the number to the studio, give us a call right now, 866-870-5752. Grab your pen, write it down, 866-870-5752. Call us live right now. We want to talk to you. If you want to call the office and get a free phone consult with our staff, they're by the phones now. You can call there at 800-300-9300. And for those of you that want to read up on this, you can go to the website and you can email us from every page there. And that's www.jointrehab.com. That's www.jointrehab.com. And every single page has a spot to email us. If you call us or you email us, we're going to send out a free copy of our book. It's a pretty hefty book, couple hundred pages. It's got about 256 studies on regenerative medicine, how regenerative medicine works, how stem cells work, how platelets, PRP works to actually regrow the tissue that's been injured, worn down, arthritic, whatever it is. And there's studies in here that actually show that surgery is not the way to go any longer. Yeah, for years surgery was the mainstay. It's shifting now. The face of orthopedic medicine, musculoskeletal medicine, is shifting. There's a new paradigm. The paradigm is be conservative. The first law of medicine is do no harm. I'm sorry to say, I love surgery. I just don't want it to have done to me anymore. And if you ever had it done, you may have had some good success, but there's an easier way to do it. Non-invasive. Get some injections. Come into the office. We draw some blood. Take your bone marrow if you want to do that with the stem cells. Very simple. The bone marrow is very easy to do. It takes about 15 seconds. We have a little needle that goes into the back of the pelvis in a place called the PSIS. That's the posterior superior iliac spine. And people say, well, I heard that bone marrow aspiration is very painful. If you're getting a bone marrow transplant for cancer or something like that, the people that do that are not very sensitive about it, and it can be painful. The way we do it, we just need a small amount. It is not painful. We numb up the area. And the first time I saw it done at UCLA when I wanted to learn this, the patient on the table, this was from a bone marrow transplant for cancer, screamed. And I said, gosh, what did that feel like? He said, he was from Bakersfield. He said, it felt like a horse kicked me in the butt. And I was reticent to do it. And then when I learned how to do it for musculoskeletal medicine, I realized it just wasn't a big deal at all.
Yeah, as long as you're numbing up that area that you're going in. Again, we use really small instruments to harvest bone marrow. Same thing when we're doing our injections. We have the benefit of using musculoskeletal ultrasound, so we can use really small needles to try to reach these targets that we're trying to heal. So every single week, patients are so surprised when I tell them, hey, you can walk in for treatment and you walk out same day, you can get on a plane, you can get back in the car, you can go back to work, because we don't have to deal with any general anesthesia, right? So a lot of places will put people completely under, which in our humble opinion is not necessary. It's an unnecessary risk for the patient. Some people just have bad reactions to anesthesia. But again, as long as you know what you're doing and you can numb up that area locally, people can get really good results, stay comfortable throughout the process, and walk out of the clinic and not have to worry about all that brain fog or potential complication from anesthesia.
So I'm going to go right to a question, and this is from our previous host, Nita Valens, who is coming in tomorrow to see us, Dr. Grove, tomorrow afternoon.
Beautiful.
She was, about 6-8 weeks ago, she hurt herself on the Pilates, her neck and her shoulder. She thought it was okay, but then her right wrist went numb, and there was nerve pain up and down both arms, but mostly on the right side. I happened to see my neurologist a couple of days later, and she ordered an MRI and showed C5 and C6 disc protruding and stenosis. She insists on a neurosurgeon evaluation, even though I told her I will not have surgery and that I'd see you. So give me your hit on I know you haven't seen her yet, you haven't examined her. Everybody who knows us, who comes in, knows we don't diagnose over stories or by other doctors' diagnoses or by MRIs or by x-rays or CT scans. So just from what you see here, give me a scenario of what you think is coming up.
So when we're dealing with neck and spine pain, it's really, really important that you're getting a proper hands-on physical exam. We talk about it every week. I talk about it with patients every day. Just because an image says something does not mean that's what the cause of your symptoms are, right? The pathology that you see in an image, whether it's stenosis or a disc bulge, a muscle tear, inflammation somewhere, does not mean that is what the reality is of your symptoms, right? So a proper physical exam, we'll be able to tease that out. A lot of times that pain is very localized, and you can press on maybe a supportive soft tissue structure, particularly in the neck. That supraspinous and interspinous ligament runs right down the middle. It's a really strong, tough, supportive structure that's a ligament. It connects a bone to a bone. And most of the time when we have people come in with neck pain, we find that's the source of their pain. Again, I can't say for sure, right? You have to do a proper physical exam. But we want to make sure that we're teasing that out. If you're talking about neck surgery, it's a pretty big surgery. Complication rate is something that you really want to look up before you go under the knife for something like that, especially for something like a fusion. So if your doctor's talking you into doing a spinal fusion, that's a really big surgery. That's one of those surgeries that you can't take back once you do. And again, every week I'm talking to somebody about once you fuse that spine, the biomechanics of how your whole body moves are going to change forever, right? So just because we've got one area, maybe it's a little more stable, typically that level above and below will inevitably, most of the time sooner rather than later, will also end up taking the brunt of that force, and now they're going to be talked into subsequent surgeries after that.
Yeah, and here's the thing. So we've got an MRI showing a C5 and C6 disc protruding and stenosis. Do you think that's the cause of what's going on with this person?
Yes, statistically, absolutely not. It's a very, very rare for that to actually cause somebody's symptoms, right?
So here's my hit on it. So this person had, somewhat of an injury, you might say, doing Pilates, and ended up having some nerves tweaked. No question about that, because it went down the arm. Mm-hmm. But we call that a radiculitis, meaning the radix, which is the part of the spinal cord where the nerve comes out, the beginning of the nerve, got tweaked. Mm-hmm. Big deal? No. But if you go to a surgeon and by the way, both Dr. Grove and I love surgeons.
Love surgeons.
Because they do the hardest work in medicine. They really have themselves on the line. We don't like the surgeries in most cases, and especially in a case like this, where these disc protrusions and stenosis don't happen from a Pilates injury. That's probably been there most of her life. Mm-hmm. So we go in, I call it a red herring. You have your hand up in front, that's the red herring, about this is what's going on. But behind you is the reality. And the reality is something so different than what doctors are looking for. And I don't know why that is. It is very frustrating for us because we spend half of our day talking to patients to educate them that what they see on their images has necessarily nothing to do with their symptoms. And we can tell this to people till the cows come home, and they don't get it because this is the culture of medicine. It's like taking medications. We don't like that either. Sometimes you have to. If you've got super high blood pressure, you better be on blood pressure medicine. You don't want a stroke. If you've got atrial fibrillation, you don't want a stroke. You want to be on a blood thinner. All of these things are going on. But most of what we see is over medication and over surgery. So we have to be super careful. And I always say it like this: the white horse that Dr. Grove and I ride is to keep things conservative. And doing regenerative medicine with platelets and stem cells is very, very conservative. And I'd say Dr. Grove, who's doing all the injections now, is one of the most conservative on the planet because he uses an ultrasound to guide his needles. He can see where that needle is going. We have a patient coming in, Dr. Grove, who's the daughter of the president of the LAPD advisory board, the policeman's advisory board. And she'll be in on Wednesday afternoon. And to me, it's a sad case. She already had surgery on her knee, which really destroyed the integrity of it. And I saw, which I'm going to send to you, I saw the results of all of this. And this person is in terrible misery because of the surgery. And we want to keep it conservative. What's your hit on that? And
yeah,
you've been on the surgical scene. You've had so much surgical training.
Yeah, and again,
we love surgeons,
and
we love surgery.
It's just the nature of what the actual surgery entails. It's it's not easy to go in and cut tissue and not cause more damage, right? So, especially when you're thinking about a knee, I had so many patients this week. Again, classic scenario where they get talked into what we call a meniscectomy. So they've got some knee pain or knee discomfort. They get an MRI and they say, "Oh, look, we've got an MRI showing that we've got a meniscus tear," right? Meniscus is a piece of tissue that sits between the thigh bone and the shin bone, provides a couple of things for the knee. So one, it's a cushion, right? So we know that when that cushion wears away, cartilage wears away. That's what arthritis is. It also provides an attachment point for a lot of ligaments in the knee. And again, ligaments provide stability to that knee. And so when you're going in and clipping out that meniscus, really what you're doing is, there's lots of studies in this published in orthopedic surgical journals, right? This isn't kind of woo-woo out there science. This is in proper journals, it accelerates your arthritis. It speeds up that degradation of that cartilage, right? And it also can provide some instability to that knee. So when you're looking at these surgeries, even though you might be talked into, it's a cleanup surgery, which just sounds good to say, we're cleaning things up, right? But really what we're doing is we're just causing more damage to that tissue. And so, like Doc said, we're conservative. We want to heal that tissue up. We'd rather regenerate what you already have, keep the stability, try to grow some cartilage, repair some of these tears, rather than take tissue out and accelerate the degradation of that knee, right? Which means you're going to fast track your way to joint replacement.
So I'm going to give out the phone number, Dr. Grove, so people can call us live because we love your calls. And the phone number to the studio right now, you can talk to us live, ask your questions about musculoskeletal pain, arthritis, any part of the body. We can inject anything, and especially with Dr. Grove on the ultrasound. What's the clarity, you'd say, on the ultrasound? Let me give out the phone number, then you can answer that question.
Yep.
Phone number to talk to us is 866-870-5752. That's 866-870-5752. Live and local. Give us a call right now. Ask us your questions. If you want to talk to the office and get a free phone consult from our staff, the phone number to the office, and there's people there now, is 800-300-9300. That's 800-300-9300. If you want to watch videos of us doing these procedures and see if it's something you'd want to do, go to the website. It's www.jointrehab.com. That's www.jointrehab.com. And you can watch videos. Every page has a spot to email us. We answer our emails every day. And for anyone who contacts us, we're going to send out a free copy of our book, $25 book. And it's got a couple hundred pages on PRP and stem cells, different body parts, how it works, and the science of it. And it's got about 256 different scientific studies on regenerative medicine of platelets and stem cells and how the surgeries are failing us, the actual studies on this. And I don't get why the surgeons aren't reading the studies in their own journals that tell them not to be doing these surgeries. Makes no sense.
Yeah, it's very frustrating when the data's out there. It's a pretty common thing every week. Someone asks, well, is there any research behind this? Again, the book that Doc wrote is a very good place to start, but I read research every single day. There's new things coming out constantly. Level 1, top-tier evidence, randomized controlled trials with humans. There's so much research nowadays that didn't exist, 30, 40 years ago, right? I'll say that, as opposed to surgery, which did. So it's relatively new, even though we know this has been going on for a very long time. But yeah, we're talking about musculoskeletal ultrasound. So it's an amazing tool that didn't exist, when we were doing these surgeries 50, 60 years ago. What we're looking at here is non-radiating energy. So it's not X-ray, it's not fluoroscopy. We don't have to worry about radiating patients. But it's live, it's real time. So what we can do is actually move that tissue around. Pretty frequently, I'm catching a couple of tears that otherwise didn't show up on an MRI.
So why is that? How is it that an ultrasound can show something that MRI doesn't show, and why is it that an MRI can show things that aren't real?
Exactly. So two main issues here is going to be MRI, X-rays, CTs. They're static images, meaning if you ever had one of those images, you're laying still. With ultrasound, I can move the body around, so we can see it in real time. In addition to that, actually, the definition nowadays is higher than MRI. Some of these machines, 7 times the definition of what MRI can show. But a lot of times with MRI, you're only getting certain slices of things. So things can look a little worse than they really are. As opposed to with ultrasound, anytime that I see what I think could be something wrong, all I do is I just flip my probe, maybe 90 degrees, 25 degrees, and I can actually see a 3D orientation of what that structure looks like. Because again, confirming what that pathology is very, very important when I'm trying to put that whole clinical picture together.
I love watching you, explain this while you're doing this with patients, because their eyes just open up and they realize that they've been sold a bunch of baloney before. And what you're getting is the real thing, actually the tissue motion, and you can see exactly what's going on. And how do you describe is there a way to describe the clarity or the definition on ultrasound as compared to other imaging like MRI, CT, or X-ray?
Yeah, again, today it's much, much higher than what you're going to get with an MRI. In addition to that, there's a lot of cool little tricks that we can use. I think it was this week, Doc, we were looking at little pocket of fluid on somebody. And, we want to tease out, well, is this an artery? Is this a vein?
Oh, yeah, that was amazing.
Right? Yeah. And again, so what we have is we have what we call Doppler. So you can actually see the energy moving back and forth to see, is this a pulsating pocket of fluid?
That was my friend Zane who came in, the soccer player. And I took a look with the ultrasound, and I saw fluid, right? I went in there first. I saw the fluid, and I thought it was from inflammation around his Achilles tendon. And then you came in and said, no, that's not fluid. It is fluid, but it's not fluid. You showed me, what was it called, the Mickey Mouse?
Yeah, Mickey Mouse there. So like in the lower extremity, typically you're going to have kind of a one center artery and two little accompanying veins. Pretty typical scenario there. So just looking at the cross section, that gave me a little hint.
Yeah, you just flipped it, and then I turned down the Doppler, which is motion sensitivity, and we saw the pulsation of the artery there. So that's an amazing tool that you use.
No, it really is. And again,
I've done it for years, but I don't, honestly, I don't have the skill and the training that you do. And when a lot of people come in to see me, they go, well, you're the old guy. You know how to do it the most. You've had the most experience. And I go, it's really not true, because I learned more intuitively from everything. I've self-injected myself for 27 years. Whenever I'm injured, I inject myself. I use the ultrasound. But you were actually trained on it by the experts of the planet, and you study it in great detail, and it seems like a major interest. I have so many interests, but it seems like your interest is to be the very, very best ultrasound injector on the planet, and I think you're doing an amazing job doing it. So my hat goes off to you, Dr. Grove. You're an amazing, amazing doctor, amazing technician. And, I love you. You're a great guy.
I appreciate you, Doc.
You're fun to be around. It's fun to come in. I like when patients see Dr. Grove, because he's a big, handsome guy, 6'2", 230 pounds of muscle. He was a previous a football player for the Cornhuskers. He was the captain of his football team. And we had one guy come in. It was so funny. Tell us the story about the patient who had actually seen you in action. Did he see you on?
Oh my gosh!
Did he see you on TV, or was he actually at the game?
No, he was at the game. That's so funny. Now we were playing. It was at Colorado, and kind of a unique thing that can happen in football is if there's a tackle. Sometimes the ball carrier, the person on offense, can get hit and do a flip in the air, and so I ended up having to be on the giving end of that hit.
Better to give than receive.
That's true. That's very true. Yeah. So this gentleman ended up flipping a few times in the air, which is kind of a unique aspect of football, and he remembered that particular moment, which was kind of interesting. How many years later?
You're famous for the triple flip.
That's it. That's it.
Gymnastics on the football field.
Yeah, life's a little different these days. Try to heal people, not hurt them. So come full circle, Doc.
Well, you're doing your best. I know that. So let me ask you this, Dr. Grove. What is the actual science on growing back tissue when someone has an injury? And I used to lecture to hospitals all the time for their continuing education, and my subject matter was regenerative medicine. And there were always a couple of orthopedic surgeons that would get up and go, "Where's the science? You can't regrow tissue. There's no science." That's why I wrote the book.
Yeah.
It took me 5 years to gather the science together. And so whenever I lecture now, I bring the books with me and I hand them out when they say, "Where's the research?" Because that's 260 some studies on it. But what is the actual science? How does that work? How do you actually grow back tissue by injecting platelets and stem cells? What happens?
So to explain this sort of part of medicine, you can get really nitty-gritty in the details. Again, I've been teaching in med schools for years. Even last year I was teaching at the med schools up in Virginia. These are the healing cells of the body. We know that platelets, we know that stem cells, and then the growth factors and all those little extra proteins, right, the exosomes, all these things are involved with tissue healing, right? So to be very simple, you take those cells, you concentrate them, and you deliver them with as much specificity as you can, right? I like to use ultrasound so I can deliver these cells on target. From there, those cells are going to do a couple of things. So the cells themselves can do some healing, right? But how we think this stuff works too is through the immune system. So there's something called a paracrine effect, meaning that the cells will talk to one another, right? So we've got stem cells all over our body that are sleeping called nascent stem cells. And we think that these messenger cells will come in and tell these cells, hey, this is an area that's injured. Come to this area, rebuild this tissue. which again, in theory is great, but we actually have firm studies now where you can look at this under a microscope and look to see that there's actual fibroblasts being sequestered. You've got granulation tissue that's there. The mature tissue comes after the immature tissue is laid down, right? The immature tissue is something that's a little mechanically sensitive, meaning you don't want to be putting a whole lot of force through it. That's why we'll talk about that here after the break.
We'll get there after the break. I'm going to give out the phone number if people want to talk to us live. It's 866-870-5752. Write it down. Give us a call live. Talk to us. Ask your questions about musculoskeletal pain. 866-870-5752. Call the office if you like. 800-300-9300. The website to watch videos, www.jointrehab.com. Hang with us.
You're listening to Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment. Stay tuned.